hepatitis C used to be a disease of a baby boomer generation. And this is because before universal precaution was practiced, there was transmission by transfusion and unprotected sex, things like that, and injection drug use in the past. And the generation that got affected the most was people born between 1945 and 1965. And post baby boomer generation, since people born since then is at lower risk, but at the same time, as many people know, the tragic epidemic of opioid use in most recent years that has caused the resurgence of hepatitis C transmission in the younger population. So it's important for us to look at the two populations distinctly and perhaps have different strategies to cope with their infection. My name is Ray Kim. I'm a professor of medicine and chief of GI at Stanford University. I'm really pleased to share our latest paper with you today. The title of the manuscript is Hepatitis C Screening in Post-Baby Boomer Generation Americans. One size does not fit all. In this study, we look at the National Health and Nutrition Examination Survey to look at the prevalence of hepatitis C infection in the general population, adult population of the United States. As a background, hepatitis C is an important transmissible disease in the US. It is transmitted by blood and body fluid, and it has been an important cause of chronic liver disease, including liver cirrhosis and liver cancer, namely hepatocellular carcinoma. Hepatitis C is readily diagnosed by blood test. It can be eminently treated by what's called direct-acting antivirals today with 99% cure rate if it is done properly, and it is a short-term treatment with virtually no side effects. So the mission today for all of us clinicians is to find patients with this infection and deliver treatment to lead them cure so that they will prevent further deterioration of liver disease, culminating in liver failure, liver cancer, and death related to liver disease. So as predicted, when we look at the NHANES data, the data set, the prevalence of hepatitis C was much higher in the baby boomer generation, 2.1%, compared to 0.5% in the post-baby boomer generation. The next layer of differentiator in terms of who has hepatitis C infection, it turns out in our analysis was insurance. In patients who had insurance, health insurance, and therefore as an indicator of access to healthcare, hepatitis C prevalence was much lower than patients without insurance. So the prevalence among those with insurance in the post-baby boomer generation was more than 3 times higher in those without insurance. Conversely, in those without insurance, hepatitis C was much more common than in those with insurance. When we look at the absolute level of prevalence of hepatitis C in those individuals, because it was so low in the insured subject, we wanted to see if there's a surrogate marker to refine the classifier better. And the next level turned out to be the serum alanine transaminase, or ALT transaminase level. And if that is low, say 23 units per liter in women and 32 units in men, the prevalence is extremely low. So these 3 layers, age, and then insurance, and then ALT, with those things, we can narrow down who actually has hepatitis C. This is in the background of a recent CDC recommendation that all US adults should undergo hepatitis C screening test at least once in their lives. And that should be repeated if you have risk factors such as ongoing injection drug use. In our experience at Stanford, we did a randomized clinical trial where we wanted to harness electronic health record to find these individuals for hepatitis C screening. And we learned that reminding patients that you are an eligible candidate for hepatitis C screening was helpful to increase the response rate. So that was helpful data. But another outcome of the randomized trial was that we found no new infection after studying 600 individuals, meaning that patients who are in care with health insurance and being actively engaged in healthcare, very few people have hepatitis C. Whereas the burden of today's hepatitis C is in individuals who are not in healthcare, who don't have insurance, and episodic healthcare, like in the emergency rooms, things like that. It is well known that hepatitis C prevalence is higher in the prison population, in homeless population, and so forth. These are people who are distant from healthcare. So my worry in starting this work was that when CDC comes out and tell primary care doctors that you need to screen everybody for hepatitis C, that becomes a mandate and a metric. And our primary care colleagues will do a good job of screening their population, but I think they will find very few new cases because they are those patients who are engaged, who are insured, who are at low risk. Whereas we'll turn a blind eye on the real population where hepatitis C is important. And that is patients that we don't see on a day-to-day basis. So in my mind, this is a reminder for public health to pay attention where the true burden of hepatitis C is and actually engage in this difficult to reach population, reaching out, testing them to discover hepatitis C. One last thing is not in the paper, but important for us to make a point. And that is that obviously screening and testing is the first step in this management. And there are recent data that indicate that patients who are diagnosed don't get connected to the next step, which is treatment, which is available, very effective, as I stated before. So multiple steps involved. We need to strategize and streamline what we do. And that's what I hope we contributed in this paper. Look at the patient's risk profile in terms of age in post-baby boomer generation, whose risk tends to be low. Let's think about who is in care. If the person is in care, we can do ALT pre-screening, for example, or you can go ahead and test them. But just bear in mind that the really burden outside healthcare, we need to go out and reach out to those individuals and then lead them to treatment so that we can eliminate the burden of hepatitis C today with all the tools that we have available to us.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.